Hold on.
Hillel Okay.
And roll.
I'm Hillel Bocian. I'm a third-year medical student at USC, and I helped co-found with Dr. Preshwich the student-run free clinic. And we've just gotten some very positive feedback from a patient here. I'm not going to say her name, and we're going to speak with her a little bit about it if she's willing, and ask her what she liked about it and who she liked and how it helped her.
And who are the other people in the room, Hillel?
The other people in the room right now are Amanda, an occupational therapy student who's incredible, who's worked with the free clinic quite a bit, and Dr. Farmer, who I've worked with to put some events together. And they're interviewing her right now, but we're going to interrupt.
Yeah, Amanda Aaron is a pre-doctoral student. She's a licensed occupational therapist, and we've asked her to go in and see Miss Davis because she has a significant wound on the foot that's going to take several weeks to heal, and we're concerned about whether or not she really can carry out her activities of daily living, and so they're basically breaking that down for her so she can function better at home and adapt to her wound.
That's right.
Okay, let's go in.
Okay. Sorry to interrupt, but I just found out that I'm going to be in a video, and apparently you two are as well. So.
Hello, why don't you go on over there and have a seat next to the lovely Miss D.
Sorry to interrupt.
No worries.
Amanda, let's see.
Oh
You are, what is your name, young lady?
My name is Amanda.
Okay, Amanda Aaron and
Michelle Farmer. Dr. Michelle Farmer.
Dr. Farmer.
Some great feedback. So.
Okay, let's hear the story.
So, you were telling me earlier how much you loved the clinic on Saturday. Could you tell a couple things that you loved?
I loved the atmosphere. I liked the personality of the people that I was dealing with me. I liked attitudes, which lacked no attitudes.
You liked that there weren't attitudes.
There weren't any attitudes.
Good, right.
I liked the gentleness that was shown to me when the first year resident cut the dead skin away from my feet.
That was Dorothy who did that. She's a second-year medical student.
Okay, and she was just as gentle as she could be.
She was under the supervision of a member of our PA faculty. That was Mr. Christopher Forrest.
Yes.
So he's a physician assistant. Yeah.
Oh, he was wonderful.
Very knowledgeable, isn't he?
Very knowledgeable.
Felt like you were with a doctor, probably.
Yeah.
It's the way he conducts himself.
What did you think of different students seeing you for different things? Like some people saw you just to talk about the meds you're taking. Some people saw you for your lifestyle.
I would think that is complete medicine,
Mm-hmm.
rounded out.
And how would you say compared with previous experiences? You told me you've been going to many doctors over the years, so.
I'm gonna tell you, this clinic here, I was in the other one. Don't get me wrong, they were good, but you guys are excellent.
Well, thank you.
Ms. Davis, when you came in on Saturday, can you just describe briefly how your foot was feeling and how it feels now compared to that?
When I came in Saturday, it was throbbing, it was running pus, and it hurt.
This had been going on for how long, ma'am?
3 weeks.
Okay. And now how are you feeling?
Wonderful.
And can you tell us a little bit about the problems that you've had with the costochondritis and how that was feeling on Saturday and how it's feeling now?
Well, actually, after she cut the dead skin away and my foot stopped throbbing, my bones did too.
No kidding. So are you able to breathe better now?
Much better. At one time, I couldn't make a deep breath.
And it really feels different
Sounds
now.
pretty deep to me. It's pretty good.
Now, I had arranged for you to see, you've been dealing with this pain for a long time, and I had arranged for you to see a chronic pain specialist at USC. But this morning you handed me the referral, and what did you tell me?
I want to stay here.
Okay, you don't feel that you need the specialist now.
I don't need a, y'all are my specialists.
Well, I'm just pleased that you're feeling well enough to say that.
You guys are the specialists.
And
So,
did you become convinced of that on Saturday when you were here? You
Yeah,
said,
that's
"This is
the
where I wanna
first
be"?
time I'd interacted with you people.
That's wonderful.
And you just stole my heart.
Ms. Davis, thank you so much for sharing that. We're trying to talk to other doctors about what we think is the value of what we would call the team-based care that you
Well, I'm
experienced.
going to tell you that. Team-based care
Yeah.
is wonderful. It makes you feel good inside.
Oh, that's
You're
great.
not waiting for one person's opinion. You're getting the whole realm of it.
Interesting. Because you know, it's funny because you said to me, well, you know, you guys are better than the other place, but the other place is here. That's what you're talking about, right? It's this clinic. How long have you been in this clinic?
I've been in this, in which one?
This clinic here where I work. This clinic, the USC Family Medicine clinic.
From the day you switched over.
Yeah. So you've been here for. I thought you were getting care here for years.
I have been here since, in 43 years, 45 years.
Okay. Yeah.
My children were born here. I did my prenatal here.
Yeah, we've had you as a patient for many years, but what's interesting to me is that the experience you had with the students kind of transformed your clinic experience. It sounds like it's like a different clinic to you.
It is a different clinic.
It's fascinating.
I like the attitudes. I like the willingness to help.
Yeah, that's nice.
I like what compassion that I get.
Yes, ma'am.
It's just wonderful, and I've never experienced it before.
Thank you for being kind enough to let me videotape so we can share your message with other people and maybe with other patients so they can understand what we're trying to do for them.
Yeah, it works, people.
All right, my dear.
Thank you.
It's a wonderful.